Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
And welcome to another episode of the Lunch Learn with Dr. Barry. I'm your host, Dr. Barry Pierre, your favorite board-certified internist, founder of drbarrypierre.com, as well as Pierre Medical Consulting, helping you empower yourself for better health with the #1 podcast for patient advocacy. And so fitting that today we are going to be talking about health advocacy, and I have a special guest for you guys today, Okey Enyia, who is the founder and CEO of Enyia Strategies, a health policy consulting firm that provides advising, research support, policy analysis, project management, and legislative strategy for individuals and entities seeking measurable ways to influence policy on issues related to health equity, health disparities, social determinants of health, and health in all policies. He also helps entry-level and mid-career professionals find ways to maximize their career advancement aspirations by reviewing resumes, cover letters, facilitating interview preparation, and providing a roadmap for a successful transition from higher education into the workforce and entrepreneurship. Okey was a Congressional Black Caucus Foundation Health Policy Fellow from 2014 to 2016. He worked 3 years with members of Congress on a wide range of areas in the context of health, education, foreign policy, civil rights, voting rights, and advocacy. He holds a master's degree in public health from Chicago State University and a bachelor's of science degree in biology and biochemistry from Lewis University, Romanville, Illinois. He resides in Maryland and enjoys cooking, reading, and traveling. And really the most important thing, you guys, I've harped on it before, that yes, we can talk about being healthy and understanding taking medications and taking the right medications, being healthy is, the way to go. But we have to understand that there are a lot of forces at hand that play a role in people being healthy. And I know, especially as I find that a lot in physicians, right, where they don't like to talk about politics and the effects of politics on the way we practice medicine. But it is extremely true. So I wanted to bring someone who's really on the ground floor, like actually they're working with people who are making these laws that are sometimes good and a lot of times not very good in your everyday order of health, right? So let's get ready for another amazing episode. Like always, if you have not had a chance, go ahead and subscribe to the podcast. Leave me a 5-star review and let Okey know that he was such an amazing guest on the podcast today. You guys have a great and blessed day. This episode is brought to you by the Lunch and Learn community store, where we are living out the motto, empower yourself for better health. In the Lunch and Learn community store, you can get your favorite t-shirts, ebooks, as well as other related products by Dr. Barry. Head over to shop.drpiersblog.com and get a chance to get 10% off your first purchase by using the coupon code EMPOWER10. Again, shop.drpiersblog.com. Live out the motto, empower yourself for better health. And again, thank you, Lunch and Learn community. You heard an amazing introduction on our today's guest, who I'm excited for to kind of, bring a little light on health policy, which I know is a taboo topic that, a lot of people don't like. It's not sexy that a lot of people like to talk about. But again, when you got people who are kind of in their field doing it, and I wanted to kind of make sure I brought that expert here. So, first of all, thank you for coming to the episode of the Lunch and Learn community.
Thank you so much for having me.
So I want to, and I say your bio is absolutely, fantastic, right? But I always like to kind of, start in the beginning, right? Like tell us the community a little bit about yourselves in your own words, and then I want to rev up, and I want to kind of talk about, what were some of your goals and aspirations as you were going through your journey.
Sure. So my background is in medicine, public health, health policy, politics, research, and teaching. I'm a former House and Senate staffer on Capitol Hill, and now I work at the Department of Health and Human Services, where I report to the Assistant Secretary for Preparedness and Response. And so I have a social justice background as a grassroots activist. I consider myself a scholar activist, and I bring the nuanced, on-the-ground perspective to the policy space, particularly as it relates to African Americans and African American men in particular. So enjoy talking about, my experience, my journey, how I got to this point. I'm the oldest of 6 children. I have 2 brothers and 3 sisters. My parents are from Nigeria. I grew up on the south side of Chicago, and I moved to Maryland in 2014 to work as a staffer on Capitol Hill. And so I'm also getting a doctorate in public health with a focus in health policy at the George Washington University Milken Institute School of Public Health, where I plan on further exploring the intersections of race, gender, equity, health, and policy as it relates to the lived experiences of African American men and boys over the life course. So that is kind of my background. I'm also an author, entrepreneur. I just released my first self-published book late 2018 that also chronicles my life experience from childhood, high school, college, grad school, med school, Capitol Hill, and into author entrepreneurship. So I'm excited to share some more details about my experiences, and hopefully it serves as an inspiration and as a way to help people kind of chart out their path to find purpose, to overcome adversity, and to pursue destiny.
I love it. And so 6 siblings, it's part of 6 siblings. Are you the oldest? Are you the youngest? Well, where do you fall?
Yeah. So I'm the oldest of 6 children. I have 2 brothers and 3 sisters. Yeah.
And that's tough because you kind of have you're the lead. Yeah.
Right. Yes, I have it's a blessing and a challenge to be the pioneer, to be the first, to kind of make the effort to lead by example. The firstborn usually has a little bit more pressure put on them, from parents. So,
speaking from an older sibling, I 100% understand.
Yeah. So,
Now, when we look at where Okey is at today, right? When you were growing up, the oldest kind of leading the charge, is this kind of where you envision yourself?
Not necessarily. I actually was in the Nigerian culture. There's this tendency to, we are known to be high achievers, right? We value higher education. We are very driven, very ambitious. And so my personal goal growing up was to become a medical doctor. And so, which is not entirely unusual, particularly within the context of the Nigerian culture, where it's, it's either doctor, lawyer, engineer, professor, something like that. So
high level, this is what we expected.
Right, exactly.
The oldest, I'm pretty sure that carries an additional set of burden on top of the burden it carries just wanting to obtain those professions.
Absolutely. So, me having kind of to carry on the mantle, of sorts, it definitely made the journey much more interesting and enriching. So, but I didn't, so maybe about 5 or 6 years ago, I didn't envision what I'm doing right now on Capitol Hill, because again, I kind of grew up thinking that I'll be serving as a physician in terms of direct patient care. But what ended up happening was that it went from direct patient care to public health to now health policy on a much broader scale. And so that's kind of a larger
community.
Right.
And in full disclosure, Lunchland community, I have a public health degree as well. I've talked about it in prior episodes that I am 100% sure I'm a different physician because of the public health degree. Because again, you could definitely correct, add to it. Like I felt that as just a general physician, it was great with the one-on-one, but I always found myself asking, well, if this person in front of me is dealing with this blood pressure, this diabetes, this cholesterol, what is that community dealing with? What are the community related problems that kind of put this person who I'm just happen to be taking care of in front of me?
Right. And so what you're getting at is what's framed as the social determinants of health, where, one's health outcomes or one's life outcomes can be determined by where you are born, live, work, play, worship. And so, all of those factors, it's beyond just the patient-physician relationship. It's what is a social context, what type of environment, place matters. And so what type of environment, and what type of influences are in motion to inform or to impact the extent to which you're able to really live the best quality of life possible.
And I definitely, so first, Lunch Learning Community, I want to kind of, we're going to give the World Health Organization definition of health policy, but I want to ask, okay, like what does he feel health policy is to him, right? Because I think it's depending on who you talk to, you get a different kind of interpretation. So the World Health Organization says health policy refers to decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. An explicit health policy can achieve several things. It defines visions for the future, which in turn helps establish targets and points of reference for the short and medium term. It outlines priorities and the expected roles of different groups, and it builds consensus and informs people. So that's the textbook definition of health policy. But when you talk about health policy and your expertise, like what does that mean to you?
Yeah, so to me personally, there's an interplay of several factors, and I use the social justice framework as the backdrop or as the foundation that informs my work. And so for me, it's an interplay between power, politics, economics, and influence. And so it's a matter of the extent to which one is able to get to the decision-making table with data, research, and compelling stories to make a case to help change minds or to better inform, whether it's in the course of a conversation or in terms of policy proposals or legislation at the local, state, and federal levels. And so, all of those factors play into what I believe policy is and does. And so for me, in terms of health policy, so what I bring to bear is the health space and all of those nuances, particularly as it relates to people of color, and how I can better drive the conversation around how to better influence and impact policies on behalf of people of color.
Is that something that always kind of attracted you to it? And I want to talk, because I know you kind of mentioned you were on path to be a physician, and we'll talk about when did that divert, but then just the race and the ethnicity behind health policy, was that something that was always kind of drew you to it, or you just, while you were going through that path, you just realized you were kind of magnetized in that area?
Yeah, so I evolved into it. I come from a lineage and a legacy of scholar activists, of entrepreneurs, of ministers, of educators, teachers, and so it's in my blood to be an advocate, to be someone that has a passion for speaking truth to power, to serving as a scholar, and so
I hope you heard that. He's truth to power. That's powerful. I love it.
Yeah, and so as I've lived and I have experiences, whether it's in college or in grad school or med school, wherever, my passion for really putting voice and language to the issues and challenges that people of color face has evolved and has strengthened. And as I have educated myself, as I have lived as a conscious Black male in this society, I've been better able to inform, to influence, to impact, to raise awareness around issues of race and ethnicity and cultural competency and all of those things that really inform policy in some way, shape, or form. And so I think the pivot point for me, came in med school, because while I was seeing patients, but at the same time, I just felt this burning desire to effect much broader change. And, having seen patients of color treated differently, talked to differently, all of that just fueled my passion to say, okay, beyond the patient-physician encounter, what things can be done in terms of public health or in a policy space that can help to address these issues that I'm seeing play out on the ground.
Now, if you ask, because I take care of patients in a hospital, I took care of patients in the outpatient clinic, and I think a lot of times the general person doesn't realize the impact these policies that are there, that are around them, that are making decisions for them, actually have on how I take care of them in the hospital, or how I take care of them in the outpatient, space. Do you find that conversation difficult to translate, to really explain to a person, no, what I'm doing here in DC, affects somebody in California and Arkansas and Florida and New York, even though you can't necessarily see it personally?
Yeah, so that's something that I've come to better appreciate about the policymaking process because, if you want to define it in terms of, so for example, I served on the Senate side. I worked on the Senate Health, Education, Labor and Pensions Committee, and where I got a chance to really understand the various policy levers that can be pulled to effect some type of change, at least at the federal government level. And so what that entailed was, as a staffer, doing research to draft a memo or to help to draft a bill that includes language germane to people of color or to Black women or to Black men or to Hispanics. And so ensuring that you're able to include language in bills or in proposals or include language in a floor statement that the member of Congress would read on the House or Senate floor, that's also an example of influencing policy. So,
have you ever found yourself, and I'm sorry to interrupt, but have you ever found yourself, if you were not in that room, maybe we could get left out? Like, if you're not in there and say, hey, we need to talk about the Black man. Do you think if you weren't there, that wouldn't even come into fruition?
Correct. And I live that every day because I can tell you now, even now, in the meetings that I attend and these hearings and briefings on the Hill, literally, if I wasn't in the room at the table, the conversation would be different, right? And so I find myself, I live to give. I'm all about servant leadership and lifting as I climb. And so for me, it's not just about me getting to the table, but how can I create a pipeline to ensure that other people of color who have the education, the passion to help to inform your colleagues who don't look like you or don't share your background? How can we create kind of a groundswell and, really kind of build out a staffing infrastructure that will bring in people of color or bring in more nuanced diversity and inclusion and equity conversations to help to draft this policy that affects the general public, right? So yes, there were times where literally if I wasn't there in the room, some things wouldn't have happened. If I wasn't there in a room, some decisions might have been made differently. So while on one hand your presence matters, but to take it further, you being able to articulate in a compelling way, which is supported by data and stories, your cases, then it becomes much more challenging for very nuanced policy to be drafted and to get across the finish line. Wow. So yeah.
And you talked especially because you mentioned cultural competency, and I can tell you as when I was a med student, and we had to take that. I think it was like a 3-week course. It wasn't long. Mm-hmm. And I remember sitting there being like, duh, of course you should do that. And I remember some of my classmates were really enamored. This was really the first time someone was saying oh, it's actually not a good idea to talk this way or lead and I think that's what sometimes gets lost on us, especially when you're in the space, when you're in the know yourself. We should be there, but it's almost surprising that if you don't actually speak up, people aren't going to pick up oh, I actually should include minorities and I actually should actually look out for them. So thank you for carrying that light, because it's got to be hard, right? Because I would assume that it's not a lot of Black males doing what you're doing. I would love to see what that room looks like when you go to a meeting and everybody else is there, just to kind of be able to do that the quote unquote head count.
Yep, absolutely. So let's say in a room full of about 100 staffers on the House or Senate side, for example, as far as Black males, will be sprinkled, maybe 2 or 3, 5 max, and then there's usually a slightly higher percentage of Black women than Black men. And so
I was going to ask that, because I wonder, I see it in the school, but I was wondering, I wonder if even in that space, the women much more represented, not as much as it should, but more than us.
Right. Yep.
Let's talk a little bit about just some of the adversity that you had to face to even get to where you're at today, and obviously still up and growing. Let's talk about, because we talked about we were in medical school, right? But in medical school, right? What was the thoughts there? What was happening? What were some things that you wish could have been different?
Yeah. So over the course of a decade, I had studied and taken the medical college admissions test 4 times, and then I applied to med school 3 times before finally getting into med school. And the last time that I took the MCAT was actually in a post-prep program called MedPrep, which is Southern Illinois University in Carbondale. And so I was able to get in, and in my cohort, I think the class size was 72 in my cohort, and out of that 72, I think 4 of us, 4 black males, and I think maybe 2 or 3 black females. And so going to a predominantly white institution.
And Lunch and Learn community, I just want to let you know, I went to Nova. It was about 200, okay, and we had 3. So his ratio is not surprising, unfortunately.
Right. And so, just kind of having to work and study in that environment, right? And so you're studying while black, and you are dealing with racial microaggressions. You're dealing with hostile classmates who aren't sharing information. You're dealing with passive aggressiveness. You're dealing with, in the context of an environment that, while I think the school did make sincere, concerted efforts to create a safe environment and as a welcoming environment as is possible, it's still, the nuance, just kind of daily interactions, made it much more of a challenge for me as a conscious black male to focus and to do well in the coursework, and also to maintain sanity for that matter. And so having to work in again, I give the programs in the school credit, for making the effort, but, at the same time, if you go to any predominantly white institution, usually one of the largest challenges is how do you best create the most welcoming, safe environment for anyone to attend that school? And then when you have the numbers, kind of factor into it, it makes that much more difficult for you to really be able to focus and to perform well on the exams and, pass the clerkships and, pass the steps, board exams and whatnot. So there's a lot there. But, fortunately for me, I guess, even getting into med school, I knew that my vision was going to be a lot bigger than just seeing patients as a physician. And so it went from, yes, direct patient care, but then the pivot into public health and then going from there. So it was the support was there, but it wasn't enough for me to perform at my peak. Yep. So I actually ended up leaving med school, and I moved back home to recalibrate. It took about a year or so for me just to kind of recalibrate from the experience of, constantly being questioned, my competence questioned, just trying to get my identity back whole, and just the self-care, the mental health, the emotional health. So just getting all of that back together.
In the back,
it took about a year. Right.
And then, I want to tell you, this story, is not an anomaly. This story is one that many of us who are in the space that and to say minority is probably more of an exaggeration. It's almost like a speck sometimes, where we don't even feel like we kind of belong, because we're again, I was in the class of 200 plus, and it was 3 of us, right? And I would look around and wow. So right. This story, when he tells this story, I picture myself back at Nova. I picture myself having to take tests and having to answer questions, knowing that I was unfortunately the representative of the whole black male community when I answered a question, right? If I got it wrong, I let the whole community down. Right. That's a burden that you have to face on top of what medical school is, which is one of the most burdensome things ever. So I appreciate it because you tell a story that is not only enlightening and true, but resonates to a lot of people. I'm pretty sure you've probably talked to others who felt right in this ilk. Oh yeah, he's if he, literally community, you could see me. The whole time he's talking
Exactly. And so, part of it too is having to work through imposter syndrome and, as you mentioned, kind of questioning or doubting whether you belong. And so just kind of working through that. And so, after I had moved back home to recalibrate, the question became, okay, well, what's next? And in my case, I was already considering getting a master's in public health. And so I applied to a few programs in Chicago, and I got into Chicago State University, which is is a minority serving institution, which was a phenomenal experience for me. And it helped me to heal and to become whole and to get my confidence back, because I was surrounded by people that looked like me and faculty that looked like me and that affirmed me. And as an aside, a quick shout out to HBCUs, definitely have love for them,
Oh, yeah.
And so my dad actually taught at Coppin State University in Maryland very early on in his career. And so, in fact, I remember, I think maybe I was in first or second grade, he brought me to the campus, and just to kind of, to expose me to the campus. And I always remember that time that I was walking around that campus, and that left indelible impression on me that still stands to this day. And so with the graduate program, because of my previous training, I just flew through the program. I was loving public health. I found my stride in terms of health policy and social justice and, that nexus. And that further informed my eventual work in the intersections of social justice, health, Black men and boys, and policy. And so after I graduated from Chicago State University, I was thinking, I'm like, okay, well, what's next? So is it a doctoral program? Is it a fellowship? What's next? And so I had to go through a little process and trying to figure out, get some clarity around my next move. And fortunately, I had some good mentors and advisors who were helpful in providing some clarity and some encouragement to me to continue to move forward. And so I applied. I had taken the GRE once, and I got into Chicago State with that score. But then, as far as the doctoral program piece, I actually took the GRE, I think 2 or 3 more times before finally getting into the program that I'm at now at GW. And I also applied to doctoral programs, I think it was 3 times between, 2013 and 2017. Now, just prior to that, I had gotten into my fellowship, which is named the Congressional Black Caucus Foundation Health Policy Fellowship, which was where I was able to work a year on the House side in Congress and a year on the Senate side as a health policy staffer. And so I went from my graduate degree in public health at Chicago State University to my 2-year fellowship in Congress, which wrapped up in 2016. And then I made the pivot into the Department of Health and Human Services in 2016, which is where I'm at currently. And I just started my doctoral program last fall. And so this is the second semester of my doctoral program, and so this is where we are.
I love it. What's a normal day for you right now? Like, especially you're working with the Department of Health. Like, what's a normal day? Are you again? Mind you, I'm naive, right? I'm in South Florida, right? So I don't know what goes on in that DC area. I just assume everyone's like around the White House. I don't know.
Yeah. So, for me, obviously it's different for each person, but for me, it's my day usually is made up of meetings with colleagues and writing policies or helping to write policies, attending hearings and briefings, either in the House or the Senate, trying to prepare for, policy decisions that might be coming down the road, as it relates to some issue area. And so whether it's, let's say the ACA, for example, or if it's Medicare for all, or if it's the pharma industry, there's a whole host of interests and, kind of issue areas that one can tap into. And so for me right now, my current space is in the disaster preparedness space. And so anything that pertains to natural disasters, hurricanes, tornadoes, wildfires, Ebola, Zika, emerging threats. So anything that pertains to those types of challenges, that is the current space that I work in. And so again, part of what I bring to the table or the conversation is the social justice bent in terms of health equity and health disparities. And so how do we lift up the communities of color? How do we lift up the most vulnerable populations to ensure that they get the support, the resources that they need to recover when things happen, whether it's a hurricane or if it's some other threat. How do we ensure that people of color or communities of color are not left out of the conversation?
And we appreciate you for sitting at that table. That's definitely, if you had to, and I know if you had to, like if someone said, well, okay, what's like the most pressing issue right now from a health policy standpoint that I, in South Florida, lowly old me, should be worried about? Like, what would you say?
Yeah, so I think,
because I'm a physician,
nationally.
Because I'm a physician, right? So, I hear a lot about the Affordable Care Act. I hear a lot about they're going to cancel this. They may cancel that. Like,
right.
But should I be scared? Like, what are your thoughts?
Yeah, so I haven't studied the demographics in Florida in terms of whether you are a Medicaid expansion state, but certainly part of the strategy as a physician would be to make every effort to get involved at the local, state, or federal levels as it relates to either the ACA or Medicare, Medicaid. Like, those issues are very important and salient, and especially now as we are approaching the 2020 presidential elections, with Medicare for All being high on a list of priorities as it relates, to those who lean left. That is definitely a high priority. And then kind of tacked onto that.
We heard that physicians, like he's saying, physicians, healthcare workers, if you're in this field, like he said, you should know. And for those who lunch learning community in Florida, like, we are not Medicaid expansion state because our governor is whatever. So.
Gotcha. Okay, good. And I didn't want to assume, again, I'm in D.C., but, I do have a good sense of nationwide kind of what states are Medicare, Medicaid friendly. And I know that, in terms of politics, so I was following the races with Andrew Gillum, and just kind of how that all panned out, right? And so certainly he has his hand on the pulse of national health politics, and so I would definitely encourage those, especially again in the run-up to 2020, to really get up to speed on the nuances of what the Medicare for All legislation will look like. Because even now, in fact, this morning, I saw several articles speaking to the fact that I think it was in Louisiana that a federal judge denied or is making a case for dismantling the ACA. And so there are states-level efforts being made to dismantle, the ACA. This has been going on since March 23rd of 2010, when the bill was signed into law by President Obama. And so we know the dozens of efforts that the right has made to dismantle it. And so again, if you lean left, if you are a progressive, then part of your responsibility is to ensure that you are up to speed on what's happening and that you're able to work closely and collaboratively with people that share your views and your values in ways that would be able to move the needle to ensure that healthcare is protected and that it is a human right. So
I love it. So people ask me all the time, Dr. Berry, like, you podcast, you blog, you do videos, and you're a physician, like how do you have the time? So I gotta ask, like, with all of the amount of work that you do, how did we get to Okey the author? Like, tell us about that. Because I want to talk about this book. I want to talk about the why. I want to talk about what was your influence, who's it for. Let's get to that. How did becoming, was that something you always wanted to do? Like, did you always have a book in you?
No, I don't think so. I think, I and this part of what I write about in the book is that maybe over the past 7 to 10 years, I would get just in passing and just like, casual conversation as I lived life, as I navigated from one space to the next, I would kind of get some type of signal or some type of, something, someone would share something just kind of randomly to say, well, you should write a book. Your experiences, would help a lot of people. And even when that was shared, I didn't really pay any mind because I was focused on actually trying to get through med school and get through grad school and, find a job. And, so I wasn't in the headspace to really kind of say, okay, yeah, it might be good to start to put pen to paper. No, it just kind of evolved. And so I think it had to have been 2019, maybe 2016-ish, around that time, where while I was in the Senate, I think I was like, okay, my experiences, like my trials, my challenges getting into med school, trying to get into doctoral programs, it's important to document. And so I began to journal, actually, I think maybe it was in 2011 or so. And so my journal was helpful in terms of having just kind of like a framework or like an outline that I was able to build out. And so by the time, so from like 2010, 2011 till now, in fact, I was able to leverage a lot of the content that I journaled daily into a format that helped me to really frame my experience in a way that was helpful. And so part of my interest and passion was to leave a legacy for generations to come and also to become an entrepreneur, right? So how do you turn your pain into purpose and ultimately, into profit, right? So, taking your
I hope you heard those 3 words: turning your pain into purpose, and then most importantly, into profit.
Absolutely, because, I believe, that nothing happens by accident. And, frankly, as a man of faith, as a Christian, I'm like, okay, how can I leave the best impact possible? How can I make this world better than how I found it in some way, shape, or form? And so those are things that really drove me and motivated me to sit down to write the book. And so practically speaking, it took about 40 actual writing hours over the course of 90 days to write the book, just to do like a big brain dump, just get everything out, get the journal together and just get everything together in one, document. And then I hired a writing coach. I hired a business coach to also help me to kind of ensure that I was going about this whole writing, publishing process the right way. So I'm a self-published author. I started writing it in December of 2017, and I finished the first draft in March, and I think it was February of 2018. And then it took about 4 months to edit it, to get it proofread, and then I launched it on my birthday last year, which is November 22nd. And then it became the question of, okay, taking that content now, right? And how do I best leverage and maximize the content in this book into multiple revenue streams? And so that's where I'm at right now, is really kind of exploring the various ways in which I could take the content, how to get a job on Capitol Hill, how to get a job in the workforce, how to find your passions, your purpose, just framing the content in a way that will be helpful and can be plugged into different areas and networks.
Oh, I love it. And was your influence, because obviously the trials that you went through played a huge role in being able to put that pen to paper. Did you delve in with a lot of experience, even when you were on the Hill, even when you were like in the thick of things within government? Did that also make the book as well?
Yes. So it is a very transparent read. I include all of my experiences, how I got, into med school, how I got into my doctoral program, how I got to Capitol, experiences on Capitol Hill as a conscious Black Capitol Hill author entrepreneurship. And it's a very transparent read. It lays out the framework that I'm helping to drive conversations that covers a wide range of issue areas as it relates to mental health and well-being, self-care, the opioid epidemic, the STEM fields, the school-to-prison pipeline, health disparities, health equity, health and our policies, my time on Capitol Hill, it's all in there. Yes.
Oh, love it. First of all, that's absolutely amazing. And putting on my, because we're both in that field from an entrepreneurial standpoint, because I definitely can see where, you have courses, whether you're speaking, right? Because I think you have a story that I think people should hear. Right. And whether we're talking about high school students, college students, honestly, even professionals who really need to hear hey, I'm here, I'm doing the work, and this is how you can do the work with me.
Absolutely. And, I'll also plug the fact that I also talked about my experience in Nigeria, which also helped to inform my sense of identity and culture, which helped me to get to this point as well. So I definitely have to give a shout out to my Igbo, culture and my people, and I kind of draw a parallel between Nigeria and Black Panther as well in terms of, living in a country that is ruled and ran by people of color and how so empowering that is. And so I definitely want to kind of plug that as well.
I love it. How can someone who is, interested in working with you, interested in learning from you, obviously interested in getting this book, right? Like, let's get this promo going, right? Like, how can I get in touch with you? Let them know wherever you're at, all your social media outlets, give them the deets.
Absolutely. So my website, so I'm also a consultant, and which is part of my business model. My website is Enyia Strategies, which is spelled E-N as in Nancy, Y-I-A, strategies.com. That's my website where you can find my book. If you want a person-signed copy, you can go to my website and I will ship you out a person-signed copy. You can also find my book on Amazon and Kindle. I've been going on book. So I've been on this whole book tour since I launched it, last fall. So almost every weekend I'm somewhere, doing a book signing somewhere. As far as social media, my Instagram is Enyia Strategies. My Twitter also is Enyia Strategies. I'm on LinkedIn as my name is Okey Enyia. Last name is Enyia, E-N-Y-I-A. My Facebook account. You can also find me on YouTube as my name, Okey Enyia. That's Okey E-N-Y-I-A. Also on Periscope as Enyia Strategies. And what else? I think that covers the social media. So IG, Twitter, Facebook, LinkedIn, Periscope, YouTube, website, my email list. If you go to my website, please join my email list, EnyiaStrategies.com. I'm in the process of actually creating an online course that is focused on creating a career roadmap for individuals who are challenged with trying to pivot from, let's say, college to grad school or from grad school to the workforce. And so I help people to successfully transition from one point to the next by creating a roadmap for them to navigate throughout the workforce in that fashion. So I can talk about how to network, how to find mentors, how to negotiate salary, soft skills, email etiquette, phone etiquette, how to search for jobs in government or elsewhere, how to find purpose and destiny and, passions and get clarity around your purpose. That's really big for me. So that's the online course that I'm creating. I'm hoping to launch it very soon, and I'm excited about what's ahead.
I love it. And don't worry, Lunch Learning Community, if you're driving, listening to it at work, all of those links will be in the show notes, so we'll make sure you get a chance. I'm also going to be giving away a Kindle version of his book as well, too, because I definitely think this is a person that you need. Because again, I've been following him for about, I think almost like a year or so on LinkedIn. And when I first started, I was like, oh, okay, this is a person I'm going to have to keep kind of close. Because when you see people working and doing work, they don't even have to say it. They're so busy working, you could just notice like, oh, wow, this person's actually putting some moves in. And so he was definitely someone who I was ecstatic about getting on the show to kind of talk to you guys, because I know health policy. I know politics isn't sexy, but it is extremely important. I promise you that medication that you're picking up at your local pharmacy, there's some policy that's made it to the price that it is at that point, right? So don't think that you are immune and in this bubble, that some type of policy does not affect what you're doing here in your little community.
Absolutely. Absolutely. It's so important to get to a place where we're able to frame issues and challenges and policies within the context of the person that lives, day to day. So how do you best connect the dots? And I think in terms of how to find relevancy with what's going on at the federal level, with what's going on at the state level, and then what's happening locally, all politics is local, power, influence, economics, education, like all of those nuances. And so part of it for me is helping to drive the conversation and create the narrative that makes what is oftentimes the amorphous policymaking process relevant and germane and makes sense and connected, right?
I love it. And before I let you go, I always ask this question: how can what you do empower others to take better control of their health?
Yeah. So, I always say that change starts with you. And I think being willing to change, which is very difficult at times, us being human and just, living. I think having a heart to serve and being willing to seek out supports and help. And so, for example, for me, especially now, it's a question of, or it's a strategy of normalizing self-care. So I go see a Black male psychologist bi-weekly. I'm in a gym weekly. As I mentioned earlier, I'm a Christian, so I go to church weekly. You know, I eat well, at least try to. So because I've been exposed to this lifestyle, to these values, I'm better able to, and I'm blessed to be able to share my experiences in a transparent way that hopefully will encourage you to make some positive changes. And so that is also a part of what drove me to write the book, to say, you know, this is what I've had to go through personally. And these are the things that I did or that have helped me to get to where I am today, where I am hopefully inspiring people and I'm helping to change people's lives based upon, you know, my story. So that is what drives me. And my hope is that the opportunity that you're made available to me on your podcast and to other radio, you know, interviews and TV interviews and speaking engagements, that this is one way in which I am hopefully leaving a legacy and making a strong impact. So
I love it. I love it. Again, Lunch Learn Community, amazing guests always. Thank you for tuning in, and we'll see you guys next week.
Thank you for getting to the end of the show. I am your host, Dr. Barry Pierre, host of the Lunch Learn with Dr. Barry, and this is another amazing episode that we like to bring to you week after week on betterment of empowering yourself for better health today. If you have not had a chance, please go ahead and subscribe to the show if this is your first time listening. If you already listen and you've already subscribed, make sure to leave me a 5-star review, because your support is absolutely important in keeping the show moving as it is. And if you have not had a chance and you want to check out today's show notes, always head over to lunchlearnpod.com. That is lunchlearnpod, all in one word, .com, and you can get the access to my show notes for every single episode, but especially the one you just listened to. And I'm going to see you guys next week. You guys be blessed. Bye.